a chat segment of Morning Coffee. And today we have Mary Ann Boccolini from Samaritan Healthcare and Hospice. So welcome.
Thank you. It's very nice to be here.
So who is Mary Ann Boccolini and what is Samaritan Healthcare and Hospice? And you've changed your name over the years also, haven't you?
Yes, we have, sir.
So first tell us about yourself.
Well, I have been with Samaritan 19 years. I started out as clinical director. I'm a nurse by background.
Okay.
And have been CEO since 2001.
Congratulations.
Thank you. It's been a privilege to serve by way of Samaritan. It's an incredible organization that helps so many people, and I'm just blessed to be part of that. And Samaritan is 36 years old.
Wow.
We were one of the first hospices in the country before there was reimbursement. So it was founded by a group of really community volunteers, a grassroots effort put forth by a community physician and then some local business owners who bought into the philosophy that we need this type of care in our community.
This type of care, and we're going to jump ahead a little bit because Samaritan has a great history to it, but what does Samaritan do? What is hospice?
Well, hospice is not a place, first of all.
Okay.
It is rendered in places, but it is a philosophy of care that is for those people who have a disease where cure is not reasonable. So therefore, the goal of hospice care is for that person to know what their goals are of care and provide comfort and support and really enhance quality of living until they transition from this earth. So it is not about dying. It is about continuing to live with a high quality of life as the person identifies that quality of life.
Okay, because you said something critical. I want to come back to it. You said living without cure, and people immediately jump to this idea, well, they're dying, so that's it. But it sounds like there's a much greater impact, not only on the life of the individual that the hospice has, but also on their families too.
Absolutely, Ira. It's so much for the family as well as the patient that we're serving. We serve all, because for someone to have a high quality of life and to have comfort, and I mean a holistic comfort, physical, of course, but also emotionally and spiritually, then that involves their family or whoever their loved ones are, because they care about each other and they're going to be concerned about each other and have worries about each other. And so we don't just focus on the patient, but all of us, so that it is holistic care.
And I know the term holistic is used quite a bit. Let's hone in a little bit on the first part, which is you mentioned the pain and the physical symptoms. And I've heard a term, palliative care. Does that come into play here?
It does come into play. Just as a very basic definition, hospice is palliative care, but palliative care is not hospice.
Okay, so you'll have to explain the difference to us.
Sure. Palliative care is a specialty, it's a medical specialty that focuses on helping patients identify their goals of care, what is important to them, and what are they willing to do to achieve those goals. And so that could be curative treatment, could be, in essence, aggressive treatment. It could be symptom management and not aggressive treatment. So, for example, if someone chooses to not go for the experimental chemotherapy, which would be the aggressive toward curative treatment, but rather, I want to have my symptoms managed. I don't want to be in pain. I don't want shortness of breath, etc. then palliative care can just honor those goals, whether the person chooses aggressive treatment or not. There are symptoms involved. There are anxieties that people have. There are emotional and spiritual issues that people are experiencing during their continuum. And so palliative care looks at the whole picture and stands back and addresses that and asks those questions that perhaps are not asked when only the disease is focused on.
I know you have on your website a resources page.
Yes.
But you also refer to a book called 5 Questions, and can you tell us a little bit about
5 Wishes.
5 Wishes,
Yes.
I'm sorry.
No, that's fine. 5 Wishes is not our document. It's a document that's used nationally, and it is for advanced care planning. So
Okay.
we've all heard of your advance directive, and now there's something that is a legal form called POLST, which identifies treatment options that you would want should certain things, certain scenarios happen. But we can't think of every scenario, right? I mean, that question of, well, would you want to, have resuscitation or, those kinds of things. I think there are those questions that certainly could be considered, but 5 Wishes goes just a little bit further with that, and the essence is really to come down to what is important to you. How do you identify quality of life? And if you and your loved ones know that, then it's much easier, should someone be not able to speak for themselves, for their family to have that guidance as to what decisions to make on their behalf.
And I'm hearing a common theme through this, which is the quality of life.
Yes.
And we need to come up for a commercial break.
Mhm.
So what we'll do is, when we come back from commercial break, we'll continue to talk and see what that really means.
Wonderful.
Thank you so much.
Thank you.
This is Ira Weissman with the nonprofit chat segment of Morning Coffee. We've got to take a commercial break, so come back and join us in 2 minutes. And welcome back. This is Ira Weissman with the nonprofit chat segment of Morning Coffee. And today we have with us Mary Ann Boccolini from Samaritan Healthcare and Hospice. Welcome back. Mary Ann, thank you again for being on.
Thank you.
When we took our break, we were talking about quality of life, and there's a significant part to this. And can you tell us about what you mean when you say quality of life?
Quality of life is defined by the person. So what is important to them, what makes their life worth living, what makes their life, each of their days, something that brings them some joy. So, there's a book that has been on the New York Times bestseller list by Atul Gawande called Being Mortal. And there's a story in there of a gentleman who was going to have surgery, and his daughter asked him, this is really serious surgery, and you might not come out of it. And if you do, your recovery is going to be very significant in terms of pain and endurance. And she said, so what is your quality of life? What are you willing to do for it? And he said, if I can eat chocolate ice cream and watch football on TV, then I'm good. So that helped her, because otherwise, if he had not shared that, she would have made another decision for him should he not have been able to speak for himself. So quality of life is, and it changes over time. I mean, the man had been a professor, and he had done a lot of writing. I'm sure eating chocolate ice cream and watching football on TV would not have been how he would have described his quality of life perhaps 5 years earlier. So that can change, and it's important for us as loved ones and us as individuals to identify that. So it's very individual, but it's what makes life worth living for you.
Okay. I need to put it into perspective,
Mm-hmm.
because we're talking about situations where, and you said it very early on, where somebody is facing a very significant medical issue or an end-of-life
Yes.
issue, is that correct?
Yes.
So we're looking at not only for the individual, but for their family, to give them the best peace of mind as they go forward into this situation.
Yes, and that's where hospice comes in, and palliative care does as well. However, palliative care can be introduced from diagnosis on. It is not only end of life, because again, it looks at the whole picture. What options are you considering? What's important to you? And you know, how can we manage those symptoms? And again, what options for care do you have? So that can be from diagnosis on. But as people go through their curative treatment and they're seeing other specialists or their primary care physician, they can interact with the palliative care specialist periodically, but they're on a treatment course. Palliative care is most valuable when there are complexities that start to develop.
When you say complexities, what do you mean?
So people, you know, if they have one or two chronic illnesses, let's say congestive heart failure and diabetes, let's say, and they're being managed. They're basically chronic diseases. But as time goes on, if the heart failure starts to worsen, the diabetes starts to worsen, and the person starts to develop maybe some chronic obstructive lung disease due to both of them, then you're adding what we call comorbidities. You're adding things, more medicines, more burden on the person, physically, emotionally, and spiritually. So at that point, palliative care is most helpful in terms of helping people to periodically stand back and say, okay, what's going on? How is this affecting everyone? What are your options? What's really important to you? And then, okay, let's base our care plan on that. And sometimes then that it eventually leads to hospice, but palliative care is very, very useful in advanced illness, but it can be from diagnosis on.
Okay. And you just made a great statement, because most people, I think, when they think about this, think, well, we've got a diagnosis, the end is near, where do we go? But there's a whole process, which I think you call in transition, where you start to think about this. And can you talk about that in transition part of it?
Well, again, as anyone goes through their life, there are different times that they reevaluate. So with the health continuum, it's the same. So if a person does go from chronic illness into more complex, or let's say advanced illness where cure is not reasonable, then that's when the holistic approach is even more important.
And you get not just the individual, but the whole family involved.
The whole family absolutely has to be involved, because that's part of that person's wellness. It's part of their quality of life, and that quality of life till they take their last breath. So, the family is certainly part of that person having a peaceful transition from this earth, as well as how those family members or loved ones move forward after someone passes.
The grief counseling portion too.
Right, but how the end of that person's story unfolds, and if it's peaceful and with dignity, no one wants to see their loved one leave this earth. But if that's going to be the case, then if it goes in a way that has some beauty to it, in that there's dignity and peace, and people can be together and support that person as they transition from here, then it's a healthier grieving, because they remember that, okay, I'm sad, very sad, but I did the best I could, and I honored their wishes, and they were comfortable, and I feel okay about that.
Now, religion plays a very strong part in many individuals' lives.
Yes.
And I know for Samaritan, they have developed programs specifically to address the different types of religions. And can you talk about that a little bit?
Sure. Well, we have, among others on our staff, we have spiritual support counselors, and we call them that because we address the spirituality. So, what's important to people, what they value, what drives them, their philosophy, but religion can play a part in that, and it can be tied to someone's spirituality, what their beliefs are and what drives them and how they feel about their life. So we try to hone in on the uniqueness of each person's faith and culture so that we can meet them where they are, so to speak. So we have a Jewish hospice program, Catholic ministry program in particular, but it crosses all faiths.
All right. Well, believe it or not, we have to take another commercial
Sure.
break. So this is Ira Weissman with Nonprofit Chat, the segment of Morning Coffee. And if you would come back and join us in 2 minutes after our commercial break, we'll look forward to talking with you. Welcome back. This is Ira Weissman with the Morning Coffee Nonprofit Chat segment. And today we've got the CEO of Samaritan Healthcare and Hospice, Mary Ann Boccolini, and we've been talking about the services you provide. One of the things that most people think about when they think of hospice is being in a facility, and you have facilities, and you also go beyond facilities also. Can you tell us about your facilities?
Yes. Well, first of all, most of the care that we provide is where people live, so it's in their own home, because that is really where people say they want to be, or it's wherever they live, so it could be assisted living or nursing home. However, we are required by our regulations to provide 4 levels of care, and one of those levels is called inpatient level of care.
Okay.
And that is for an individual whose symptoms cannot be managed in the home. Or if they could be managed, meaning that we do infusions, we have staff to send out, but many times it's very difficult for the family. Let's say if someone's having seizures or things of that sort, that is very difficult for the family to handle at that time. So instead of going back to the emergency room of a hospital, which has its definite purpose, but not in this instance, it's really where people don't want to go back to the emergency room and get admitted. This is a facility, if you will, that is very home-like, and there is a lot of intense care that goes on there. However, it is a very peaceful environment, so to the patient and the family, it's the second best thing to being home. So we have a unit in Memorial Hospital, Virtual Memorial Hospital in Mount Holly. Within those walls, it is our unit. We utilize that space, and we are building a freestanding 18-bed private room house, if you will, the Voorhees Samaritan Center at Voorhees, which will be on Route 73 in Voorhees.
Okay. Now, you mentioned Virtua. You partner with 4 or 5 different hospitals in the area, and those are who?
Well, we serve everyone that calls us in our service area. We are the preferred provider for palliative care and hospice for the Virtua Health System, the Kennedy Health System, the Lourdes Health System. But as I said, we, as far as health systems, we have patients from all of the health systems because patients have choice, and many choose us.
Well, the fact that the major hospitals are saying you're our preferred partner says a lot, and you've won some national awards also, haven't you?
Yes, we take quality extremely seriously. And for 3 years in a row now, we have been given the award from our patient survey company that is, we benchmark nationally with 1,700 other hospices, and we have been designated as Hospice Honors, which is 16 out of the 18 domains we have surpassed the benchmark. Or last year, we were awarded Hospice Elite, which was 18 out of the 18.
That's great.
Yes. Thank you. And that's it's just testament to every single person on our staff.
You had mentioned earlier that you partnered with these hospitals, but you also said the people don't have to come from there. What is your service area?
We serve 2,200 square miles, 5 counties, so Mercer, Camden, Burlington, Gloucester, and Atlantic counties. But you know, in terms of people coming to us, the doctor does have to approve, but people can call, and that's a struggle for some people because they don't know when to call us. They think they have to know exactly when to call us, and many wait. And what we hear most often once a patient does come to us is that the family says, we wish we would have called you sooner. So my strong suggestion would be that if people are experiencing these complexities and you know, more doctor's appointments, having news that, you know, there's not a lot of curative treatment left, or maybe there is no curative treatment available for them, but they have living to do, or even if they're just experiencing symptoms and they're not at that point, but things are just becoming more complex, just call us. It's just a phone call, and I guarantee that we can help the person, even if it's giving them referrals to other resources that absolutely could help them. But give us a call.
Okay, well, you've given us a great lead-in for the end of the show, but I want to point out something else. On your website, you also have a full resources page.
Absolutely.
With a lot of good information.
Yes.
So with that being said, you said give you a call. What's your phone number?
It's 856-596-1600.
Okay, I'm going to ask you to repeat it.
856-596-1600.
And your website?
www.SamaritanNJ.org.
Okay, and again, one more time, please.
www.SamaritanNJ.org.
Mary Ann, thank you so much for coming on. I know we've only touched the tip of the iceberg here, and there's so much more to discuss in this area, so we're going to have to get you back on sometime.
Thank you for this opportunity, and as you said, our website has a lot of information.
Oh,
Thank you.
You're welcome. This is Ira Weissman with the nonprofit chat segment, Morning Coffee. If your nonprofit needs help with strategic planning, putting measures in place, succession planning, or any of the processes that go into making a successful nonprofit, please feel free to reach out to me. My website is www.idea-innovations.com. Thank you very much and have a great day. Goodbye.